Many hospitals around the country are in need of more than just supplies. They also need more doctors and nurses. Our Tony Atkins looks at what we're doing here locally to recruit them.
Nearly a week into statewide school closings and restaurant shutdowns, COVID-19's impact in Wisconsin is felt. Nearly any industry you can think of is impacted. Perhaps none more than the medical field, which braces for more COVID-19 patients.
This is a little bit more intimidating for a number of reasons. We don't really know how it's going to play out in Wisconsin in terms of how big the surge will be.
Mark Kaufman is the chief medical officer for the Wisconsin Hospital Association. He says one of the biggest challenges hospitals could face is keeping its workforces healthy.
The infection rate for healthcare workers has been about 10%. And if there really is a wave of patients, that is one of the biggest concerns is having a healthcare workforce available.
He says hospitals are finding new ways to make sure the workforce numbers are sufficient at such an unprecedented time.
We are looking into, and hospitals are looking into, retired physicians, retired nurses, extension of licenses, expediting cross-state licensing for people who want to come and work and join the workforce.
Kaufman says now hospitals have enough ICU beds and ventilators, but nurses and doctors still remain in need.
Hospitals and their staff are coping with this shortage of personal protective equipment.
And as COVID-19 continues its spread, Kaufman says it's unclear what impact it will have in the long run.
It's really hard to predict what's going to happen at the end of 2020 when we're still figuring out what's going to happen in the next 2, 4, and 6 weeks.
In Milwaukee, Tony Atkins, TMJ4 News.